HIV infection, as we know today, we know that it was there since 1981, and when previously people used to be diagnosed with HIV infection, that was a almost sure shot that this patient is going to die very soon. But the things have changed today. We have with us Dr. Pradeep Bhattacharya, who is the Director of the Emergency and Critical Care Services, Chirayu Medical College, Bhopal. Dr. Pradeep, tell us about the history of it. It will be interesting to know the HIV, how the HIV has changed over the years.
Yes, Dr. Chawla, history is very interesting because it started with the findings of pneumocystis infection in patients in one of the hospitals in New York, where subsequently they found that 3, 4, 5 cases, one after another, they are developing this pneumocystis infection. And they thought why this is happening, and then they retrospectively tried to find out the cause, and they came out with the conclusion that these patients are suffering from severe kind of immunodeficiency syndrome, and then after it was discovered that yes, HIV is something which is causing this kind of infection. Thereafter, it really took a very virulent form all over the world, especially in African countries, developed countries, although they were fighting. Developing world also started getting these kind of infections, and as we know, these are more prevalent in drug abusers as well as sex workers. So it was very prevalent in those communities. So in the year 1996, this heart therapy came, antiretroviral therapy, and although it was a very effective kind of therapy, but what it shown that although it is controlling the complications and the problems which is arriving because of HIV, but somehow it was not able to control the number of cases which are getting admitted in ICU, intensive care unit, because giving therapy with heart was having its own complications like development of iris. That was one of the things. And another thing which was observed, that initially the patient group, the age group actually, which was getting involved with HIV infection was between 24 to 40 years of age. But now if you see today, if we look at the epidemiology and prevalence of the disease, now we find that the age has shifted from 40 years to 50 years. Now most of the patients, they are of older age group.